Joining us to talk about this new medication and all things medicine, Dr. John LaPook. Welcome.
Well, great to be here, Vlad.
All right, so this seems dangerous.
Special K.
Special K for your nose, nasal Special K. Is it dangerous?
It's not quite that. I love the way you're putting it.
It's a nasal spray, right?
Right, it's a nasal spray. So, and this has been used in anesthesia for about 50 years. Intravenously, it's felt to be very safe. The Special K was a form of it that was being abused by people to get high on the street in a higher dose than what we're talking about here. This is something that's been developed in a nasal spray, lower dose than what's used on the street. And the thing that's very compelling about it, it's still early days, is that it kicks in quicker. And one of the big problems with antidepressants is that they can take weeks, months to work if they're going to work,
or not work,
and then you have to adjust the dose, and meanwhile people are desperate.
Yeah. So the other thing about these antidepressants, the current sort of crop of antidepressants, as I understand it, but you know more than me, is that they kind of generally work the same way.
Right.
Does this work differently to improve your mood?
That's such a great question. So they've basically gone after these neurotransmitters, so serotonin or norepinephrine, that are sitting on the cells, and they help the cells in the brain talk to each other, the nerves talk to each other.
Yeah.
This is going after a total other type of neurotransmitter called glutamate. That hasn't been approached before. So it's exciting to think, all right, we're going in a different pathway. If I had a cell here, you would see it's a different place on the membrane where the receptor is. So we're going after that, and somehow, and believe me, they do not know exactly why it would work more quickly than going after, say, the dopamine, the serotonin receptor, or the norepinephrine receptor. Those are the traditional drugs you've heard of, like Prozac and Cymbalta. These are ones that, by the way, if they work, great.
Yeah.
Stay on them.
Stay on them. The expert, Dr. Charney, who was one of the people who developed this, and I have to always say, in full disclosure, he actually will share in some of the profits of it. He has a piece of the patent of it.
Got it.
It was developed at Yale and Sinai.
You mentioned the fact that ketamine was abused in the form of Special K on the streets, but. And again, as to Anne-Marie's point, that I don't know a lot about medicine, if anything, but I wonder, are there certain narcotics that have been abused illegally that in a form that is low dosage and non-addictive have been helpful, like cocaine, for example, that you could use as an actual medicine to help people, but it's been abused and it's a different iteration. Again,
these are such sophisticated questions and great ones, and yes. So I think that a lot, but it's yes with an asterisk. So I think a lot of people who are abusing drugs are self-medicating. I mean, it is such pain. I've had patients who have deep depression, and this is treatment-resistant depression, not your normal type of depression, the ones that haven't responded to at least 2 different types of therapies. They describe it as being like you're sinking to the bottom of the earth, and there's no bottom. And one of the things that antidepressants do is they give you a bottom. Maybe it's not a happy pill, but you're not going to sink lower than that. So you can imagine on the street, people may be self-medicating with opiates. It's not that it's necessarily in a certain dose, if it were in a lower dose, that it would be actually specifically targeting a neurotransmitter and helping you to be less depressed. It just may be dulling the pain. But I do wonder about ketamine with Special K. Were some of these people self-medicating their depression?
Yeah, so I have one more question about this, because I know there are a lot of people out there suffering with depression. And one of the other things that I've learned with some of these drugs is that often people start to feel good, then they come off the drug, and then when they try to get back on, they either need a higher dose or it doesn't work as well. I know it's early days for ketamine, but do we know, how ketamine reacts to this? Yeah, so
yes, we need to follow these out long, and I think that's a great caveat now. We are in early days, and by the way, one of the patients who I spoke to had both was using both ketamine and the antidepressant that she was on. So you may see a mix and match. One size doesn't fit all. And you may start off with 2 sprays a week, go to 1 a week, and then try to see, well, can you stop it at some point?
Right.
What happens over time? But I should say that there are some potential side effects. Dissociation, feeling of being sort of dissociated. You could have oversedation, blood pressure and pulse can go up. So it's going to be recommended, if it's approved, to be given with supervision, make sure that the person's okay. And then we have to look to see, number 1, are there unexpected side effects? And 2, over time, is this really working the way we expect it's working?
So, Dr. LaPook, let me ask you about one other thing that's making headlines today, the news about a second HIV patient being cured. The President of the United States just tweeted about it, although I think that, and this is why I think a lot of people are going to be curious about this news. He tweeted this: HIV cured in second patient, doctors report at New York Times. Such great news for so many. This is the second person that's been cured.
Well,
It's
I feel
very
like there's some
expensive.
important qualifying
exactly.
words that
There's
aren't being
a lot
included.
of things that need to be explained about
And
a patient being cured of HIV.
Or appearing to be anyways.
And I actually was in communication with Tony Fauci, who's the head of infectious diseases for the NIH and leads up the HIV effort. So this is a proof of principle, and what's going on, just very simplistically, is there is a receptor, this little protein that's sitting on the surface of white blood cells, and that's the thing that the HIV virus binds to, and that's how it gets into the cell. So what happened when this patient, who happened to have lymphoma, a form of lymphoma, is they wiped out his own his own cells, his own
it was like his white blood cells,
his white cells, his red cells,
this.
right?
Yeah.
And they gave him a bone marrow transplant. Okay, so now he was getting cells from another person, and that person happened to have a mutation in that receptor, so that it was not, the HIV could not attach to it.
Did they know that before they gave him?
Yeah, I think they did know it, okay? And so because 12 years ago, this Berlin patient had that, and they said, let's try to repeat that, because he seemed to be cured, but they weren't able to repeat it, okay? So they said, okay, we're gonna try this, and after 18 months, this person doesn't have any evidence of HIV. Now, think about it, though. If you're gonna scale it, and this is what Dr. Fauci pointed out, if you're gonna scale this up to the millions of people who have HIV right now, it's really, how are you going to do that? Because you're going to have to give them chemo, which this person had. It's a big deal. So it's not really easily scalable, but what it is an exciting proof of principle that says, okay, how else could we affect that receptor that's on the top of that cell? And by the way, there are other ones. So just because you take care of that one, there are other forms of the receptor that the HIV can get into. So now you hear about CRISPR, which is gene editing. So in the future, the thought is that if you can figure out a way to, without wiping out the person's bone marrow, get the CRISPR editing mechanism into somebody who has HIV and edit that receptor and make it either go away or turn it into a form that is not able to bind the HIV. So it's a proof of principle that in the future you might be able to widely scale it, but in terms of using this exact technique to treat so many, it's probably not a feasible thing to do. And right now you can take a medication if you're HIV positive and keep the levels down. So it's
live
not like
a
they're
very
gonna go off that.
long, happy, healthy life. Dr. John LaPook, thank you.